Good day, everyone. Hope you are enjoying your day. I want to discuss nerve growth factor, NGF, because I've made the connection that increasing nerve growth factor plays a good, like improves mood and can also, improve cognitive development, improve cognition, and that sort of thing. And so I did an AI search on that, and I have some you know basic knowledge about I've got actually some knowledge about nerve growth factor, and so I kind of started my search maybe before some people, whoever might be listening, may not know anything about NGF or nerve growth factor. So anyway, like I'll let you know what it is and how it helps humans, and then kind of discuss ways to increase nerve growth factor, ways to decrease nerve growth factor, and the effects of doing both those things, and just kind of discuss the topic overall, and go into some detail on some of these different topics. But anyway, how does nerve growth factor help humans? Practical impact: protects neurons and prevents degeneration, promotes nerve regeneration, and enhances sensory function, supports immune and tissue health, and so keeps neurons alive, helps them grow and regenerate, supports sensory and autonomic function, aids wound healing, modulates immune responses, contributes to brain plasticity and stress adaptation. So at least you have you know the basics of what it does and why it's important for humans. And so we'll discuss some ways to increase it, and we'll discuss ways to decrease it, and also the effects of doing that, and just go from there. So I asked AI, what are some good ways to increase nerve growth factor, NGF? And the answer is the most reliable ways to increase nerve growth factor, NGF, are lifestyle-based, especially exercise, along with certain dietary patterns and possibly some supplements. Below is a structured, evidence-grounded breakdown of what actually moves NGF levels based on current research. Number 1, exercise. Strongest evidence. Regular physical activity is one of the most consistently supported ways to elevate nerve growth factor. Research shows that exercise-induced cognitive improvements depend specifically on NGF signaling, and blocking NGF eliminates these benefits. Why it works. Exercise increases neurotrophin production, enhances cholinergic function, and supports hippocampal plasticity. The most effective forms. Aerobic exercise, examples running, cycling, or brisk walking. High intensity intervals, consistent moderate intensity training. Number 2, polyphenol rich foods. Plant polyphenols found in berries, tea, cocoa, olive oil, and colorful fruits and vegetables modulate neurotrophin pathways, including NGF. Mechanisms: reduce neuroinflammation, activate Krebs signaling, improve synaptic plasticity, reduce oxidative stress, and top polyphenol sources. Number 1, blueberries and blackberries. Number 2, green tea, EGCG. Number 3, extra virgin olive oil, hydroxytyrosol. Number 4, cocoa flavonols. Number 5, turmeric, curcumin. Number 6, resveratrol, grapes, red wine. And then number 3 is nutrients that support NGF production. NGF is not consumed directly. The body synthesizes it using nutritional building blocks. A review of nerve regeneration nutrition highlights the importance of balanced micronutrients for nerve health. Key nutrients involved: omega-3 fatty acids, DHA/EPA, B vitamins, especially B1, B6, and B12, vitamin D, minerals zinc and magnesium, amino acids supporting protein synthesis. These nutrients help maintain nerve integrity and support regeneration processes that rely on nerve growth factor. Number 4, lifestyle factors: stress, sleep, recovery. NGF levels are sensitive to systemic stress and recovery patterns. A review on sports, nutrition, and neurological health emphasizes how lifestyle factors, including physical activity and dietary patterns, modulate neuroplasticity and neurotrophin activity. Helpful habits: high quality sleep, 7 to 9 hours, stress reduction practices, meditation, breath work, avoiding chronic inflammation, processed foods, and smoking. And number 5, supplements with emerging evidence. According to a nutrition review, certain supplements may stimulate nerve growth factor, though human evidence is still developing. Most discussed candidates: lion's mane mushroom contains hericenones or arenosines that may promote NGF synthesis. Curcumin, polyphenol with NGF modulating effects. Green tea extract, EGCG, resveratrol. Important: evidence is promising but not definitive. Consult a healthcare professional before starting supplements. And number 6, maintain NGF balance. Excessive NGF can be associated with inflammatory pain conditions, so the goal is healthy regulation, not maximization. A most effective evidence-backed NGF boosting strategy: regular exercise plus polyphenol-rich diet plus adequate micronutrients plus good sleep and stress management. This combination has the strongest scientific support and is safe for long-term brain and nerve health. So then I asked, what are some good ways to decrease nerve growth factor, or NGF? And this, I don't think has been studied quite as much, but there's a the study the decreasing NGF to decrease pain. Sometimes people have, when there's too much NGF, people experience pain. So the answer is the only well-supported ways to decrease nerve growth factor, NGF, involve blocking its signaling pathways, primarily through NGF neutralizing antibodies, NGF receptor inhibitors, or related molecular targets. These approaches come from pain management research, where reducing NGF is a therapeutic goal because elevated NGF drives chronic pain sensitization. Because NGF is essential for neuron survival and normal CNS function, any attempt to reduce it should only be done under medical supervision. I'll outline what the research shows with citations. Number 1, NGF neutralizing antibodies. Direct NGF reduction. Monoclonal antibodies that bind NGF directly can reduce its activity. These have been tested extensively for chronic pain conditions such as osteoarthritis. Anti-NGF antibodies reduce NGF signaling and nociception. However, long-term or high-dose use has been linked to accelerated joint damage in some patients. These are not available over the counter and require clinical oversight. So the examples that they give are tenezumab, fasinumab, and volrustomig. And number 2, NGF receptor, TRKA inhibitors. NGF exerts its effects mainly through TRKA receptor. Blocking TRKA reduces NGF signaling without necessarily lowering NGF levels. small molecule NGF TRKA inhibitors have been developed and show nanomolar potency in suppressing NGF activity. These are experimental and not used outside research or controlled clinical trials. Number 3, neuropilin-1 NRP1 inhibition. A major recent discovery, neuropilin-1 NRP1 acts as a core receptor that amplifies NGF TRKA signaling. Inhibiting NRP1 suppresses NGF evoked nociception, pain perception, and reduces NGF TRKA signaling. NRP1 antagonism is being explored as a safer alternative to anti-NGF antibodies. This is a promising future direction for reducing NGF-related pain sensitization. And number 4, P75-NTR pathway modulation, indirect NGF reduction. NGF also binds the P75 neurotrophin receptor, which can trigger pro-apoptotic, programmed cell death, or growth-limiting pathways. While not a direct NGF-lowering method, modulating P75-NTR can shift the balance of NGF signaling toward reduced trophic activity. This is still an emerging research area. And number 5, anti-inflammatory strategies. Indirect NGF reduction. NGF is released by immune cells during inflammation. Mast cells, lymphocytes, and macrophages release NGF in response to inflammatory stimuli. Reducing inflammation can therefore reduce NGF release. This is an inference based on cited mechanisms. Lowering inflammation means fewer immune cell NGF signals. And an important safety note, NGF is essential for neuron survival, synaptic plasticity, and normal CNS function. Research shows that reducing NGF too much can cause neurotoxic changes, including astrocyte atrophy, increased neuroinflammation, neuronal death when astrocytes are NGF deprived. This is why NGF lowering therapies are tightly controlled and not used casually. In summary, scientifically supported ways to decrease NGF or its signaling. NGF neutralizing antibodies, most direct but with safety concerns. Number 2, TRKA receptor inhibitors block NGF signaling. Number 3, neuropilin-1 inhibitors, new promising, suppress NGF TRKA signaling. Number 4, P75-NTR pathway modulation, indirect. Number 5, reducing inflammation, reduces immune cell NGF release. All of these are clinical or experimental, not lifestyle interventions. So then, we'll go over this again. Like what does nerve growth factor do, and how does it help humans? And nerve growth factor is a neurotrophin, a specialized protein that is essential for the development, survival, and maintenance of neurons. It helps humans by supporting the nervous system, immune system, and tissue repair processes. Below is a clear, evidence-grounded explanation based on scientific resources retrieved. What NGF does: core biological functions. Number 1, supports neuron survival and development. NGF is the best characterized member of the neurotrophin family and is critical for the development and maintenance of both the peripheral and central nervous systems. It controls cell survival, differentiation, growth cessation, apoptosis, programmed cell death. These functions are mediated through 2 receptors. TRKA promotes survival and growth. P75-NTR can promote apoptosis depending on context. Number 2, maintains sensory and sympathetic neurons. NGF is essential for the development or the proper development and long-term maintenance of sensory neurons, pain, temperature, and touch, sympathetic neurons, autonomic nervous system. This is why NGF is heavily studied in pain research and neurodegenerative diseases. Number 3, regulates wound healing and tissue repair. NGF influences epithelial cell repair, fibroblast activity, angiogenesis, new blood vessel formation. This is why recombinant human NGF, German, is FDA approved for neurotrophic keratitis, a degenerative corneal disease. Number 4, modulates the immune system. NGF is produced by many immune cells, including mast cells, lymphocytes, granulocytes, antigen-presenting cells. NGF affects immune cell activation, differentiation, survival, and migration. This makes NGF a pleiotropic factor, active far beyond the nervous system. Number 5, supports brain plasticity and stress responses. NGF influences synaptic plasticity, neurotransmitter regulation, stress-related responses in the hypothalamus. Rita Levi-Montalcini's work showed NGF levels rise during stress, suggesting a role in adaptive responses. And how NGF helps humans, we'll go into this a little bit more depth. Practical impact. A, protects neurons and prevents degeneration. NGF helps keep neurons alive and functioning. This is why NGF is being explored for Alzheimer's disease, peripheral neuropathy, spinal cord injury, and age-related cognitive decline. B, promotes nerve regeneration. NGF stimulates neurite outgrowth, helping damaged nerves regrow. This is crucial in injury recovery, corneal nerve regeneration, peripheral nerve repair. And C, enhances sensory function. NGF maintains sensory neurons, which support pain perception, temperature sensing, and touch sensitivity. And lastly, D, supports immune and tissue health. NGF's role in immune cell activation and wound healing helps maintain tissue integrity, inflammation balance, recovery from injury. In summary, what NGF does for humans. Nerve growth factor is a master regulator of nerve health. It keeps neurons alive, helps them grow and regenerate, supports sensory and autonomic function, aids wound healing, modulates immune responses, and contributes to brain plasticity and stress adaptation. It is essential for both early development and lifelong nervous system maintenance. And then lastly, I explain what happens when NGF is too high or too low. NGF that's too high and NGF that's too low each cause very different and very predictable biological effects. The research you triggered in the search results give us a clear picture of how NGF dysregulation affects the nervous system, immune system, pain pathways, and even psychiatric function. Below is a structured, evidence-grounded explanation with citations. When NGF is too high, high NGF, more pain sensitivity, more inflammation, and sometimes abnormal nerve growth. Number 1, increased pain sensitivity, hyperalgesia. NGF is released in high amounts during inflammation by mast cells and immune cells. It induces axonal outgrowth in nociceptive pain neurons, increasing pain perception. This is why NGF neutralizing antibodies like tanezumab were developed to reduce NGF-driven pain. Number 2, heightened inflammatory responses. NGF is a major immune modulator. High NGF levels amplify mast cell activation, T cell maturation, local inflammatory signaling. This can worsen inflammatory pain conditions. Number 3, psychiatric associations. A scoping review found raised NGF during acute alcohol intoxication and withdrawal. Raised NGF predicted conversion from depression to bipolar disorder. This suggests high NGF may reflect acute stress or neuroimmune activation. Number 4, possible weight loss. Clinical trials using NGF infusions reported weight loss, likely via hypothalamic mechanisms. And number 5, potential for abnormal nerve sprouting. Excess NGF can cause excessive nerve fiber growth, which is one reason anti-NGF therapies are being explored for osteoarthritis and chronic pain. And then when NGF is too low NGF, impaired neuron survival, reduced plasticity, and vulnerability to degeneration. Number 1, neuronal atrophy and loss. NGF is essential for survival of sensory neurons, sympathetic neurons, cholinergic neurons in the basal forebrain. Without NGF, these neurons undergo apoptosis. Number 2, cognitive decline and neurodegeneration. Low NGF is linked to Alzheimer's disease, Parkinson's disease, age-related cognitive decline. Because NGF maintains cholinergic neurons, low levels accelerate degeneration. Number 3, mood disorders. A psychiatric review found NGF levels are definitively reduced in bipolar disorder and major depression. Low NGF means impaired neuroplasticity, means impaired mood dysregulation. And number 4, impaired stress resilience. NGF normally rises during stress to support adaptive responses. Low NGF reduces the brain's ability to cope with stress. Number 5, poor nerve repair and regeneration. NGF drives neurite outgrowth and nerve healing. Low NGF means slower recovery from nerve injury. And lastly, number 6, immune dysfunction. NGF regulates both innate and adaptive immunity. Low NGF may impair T cell maturation and immune responses. A summary table. So the NGF level is going to be too high or too low, and then I'm going to look at key effects and looking at evidence. So NGF level too high, increased pain sensitivity, increased inflammation, abnormal nerve sprouting, weight loss, and stress-related spikes. Evidence: immune cell NGF release and nociceptor sensitization. So there's some different evidence that they give, which I'm not going to click on right now. But anyway, and then NGF level too low causes the key effects are neuron loss, cognitive decline, depression, poor nerve repair, and immune dysfunction. And they give some evidence, and there's some sources for that as well. And the big picture, NGF is a Goldilocks molecule. Too little causes neurons to die. Too much causes pain and inflammation spike. Its balance is crucial for brain plasticity, mood regulation, pain perception, immune function, and nerve regeneration. So that's why I stopped it there. But I wanted to discuss NGF because I think it's important to kind of expand some knowledge on, I'm not the only one that thinks that increasing nerve growth factor seems to improve mood and cognition. So there's two things that are very important that can help people with different conditions, and obviously there's even more than that I've learned from reading this. And anyway, hopefully it's somewhat helpful. It's just something that I found helpful. There's many ways to do this. Again, we'll just go over some. There's polyphenols. Exercise is strongest evidence is exercise. Polyphenol-rich foods. And then there's nutrients that support NGF. Lifestyle factors, stress, sleep, and recovery. And there's supplements as well. So there's many things that can be healthy. That can be helpful for this. We'll leave it there. Hope you have a wonderful day.